Hey, beautiful babes. You've just found yourself in Toxland. We're your hosts, Bre and Jessie, two besties on a mission to shake up the beauty industry from the inside out. We're here to spill the tea and the toxins while building a fierce community that's informed, empowered, and a little bit nutty. Whether you're a seasoned pro, just curious, or here for the toxic stories, we've got something for everyone. Buckle up, buttercups. It's time for Toxland.
And they it starts raining everywhere.
It's gross.
Yeah, and it's just like, oh, that mist.
Legionnaire's disease.
Yeah. They have one in Las Vegas, which makes it even dirtier. I've been to the one in Las Vegas.
I love it so much. I can't explain to you. It's like being in a time warp. All the animatronics work. Like, it's beautiful. I would love to go.
I mean, when I think about going to drinks with friends, I think Rainforest Cafe. It's on the top of the list.
I won't stop talking about it.
But those are all like, the Planet Hollywood era or the Hard Rock Cafe. Like, there was always the theme restaurants.
That's why I'm obsessed with it so much. It's like this thing that's dying, and they're doing a really good job of keeping it up. Like, the animatronics work. You can't even say that at Disney. A lot of the animatronics is like, that needs to be repaired.
Like one arm.
Yeah. No.
Yeah, recently my husband and I and our couple best friend, we went to Disneyland, and it was probably close to 100 degrees. It was miserable. And we were so relieved to finally go on It's a Small World because we wanted to get a beat, from the heat. And the ride shut down while we were in it. So It's a Small World. Okay, that's annoying.
That was nice, though.
But it's annoying to hear that just for the ride. We were stuck in the middle of it, hearing that song over and over and over again for 45 minutes.
I like that
I thought
song.
I was going to lose my fucking mind.
It's like Christmas music. I could listen to it forever.
I have a similar... So, my son who has autism, this is a long time ago. We haven't been to Disney since, but, not because of this.
Traumatized.
But because of his autism, we were able to get, a special pass that allowed us to essentially go to the front of the line on every ride.
Nice.
As a side note, there were some wealthy New York families who would hire people in wheelchairs to get disability passes for that purpose, and so they kiboshed that whole thing. But at the time, he just wanted to go on It's a Small World, and we did it about 10 times in a row.
Shut up.
Yes.
It's like torture.
See, he needs to go with me. We'll have a great time together. I'll take him on all the... No, I love going to Disneyland with kids. I turn into a child. I'm like...
The first time I ever went to Disneyland, I was 30 years old with Jessie. I had never been as a child. My parents never took me. I didn't know what to expect. It was blazing hot. I don't do well when I'm hot and in jeans. I didn't dress well. I was pissed off the whole time.
Weren't we hungover?
Usually.
Oh, yeah. We were brutally hungover.
And I didn't have the best time. It was I was kind of let down, but we went back when it was cooler, and I had the best time. And I've been having the best time since. So we've been to Disneyland a few times, and we went with, our friend Rachel, and I was sure that I couldn't ride roller coasters. I was like, they're going to make me sick. It's just not for me. She's like, just do it. I went on that roller coaster 4 times. I love roller coasters now. My fear is gone. I'm not sick anymore. So anyways.
That's actually my dream, to go as an adult without kids.
Oh, it's
because
fun.
then you can drink and you're just kind of, I'll go with you.
Come with me. I know the things.
She is fun to go with, and we have really good friends that work at Carthay Circle, at California Adventures, so really fine dining, and they're really fun to hang out with. One year we went to the Oogie Boogie Bash there as Troop Beverly Hills.
That was fun.
Yeah, for Halloween.
We got it.
Yeah. So, anyways, everyone, welcome back to Season 2 of Babes in Toxland. Today we have Portland's best and most beloved facial plastic surgeon, Dr. Michael Kim. Thank you so much for being here with us.
You're the Miss Congeniality of Portland plastic surgeons.
Yeah, that's what we decided your name is. Mr. Congeniality.
Yeah.
I'll take it.
You are just so loved, respected, and I think that you're a very powerful, amazing force in our community, and I'm so glad that you're here in Portland with us.
Well, I think that's, being a plastic surgeon, a lot of people like to hate being in this industry in general, and you are definitely someone who is just loved across the board. Like, I've never heard anyone say one negative thing about you.
Absolutely not.
Oh, they're out there.
Send them my way.
Something that, I teach a lot within my job is breaking stereotypes. Identify the stereotypes within your industry and do the exact opposite. Another thing that Disney does really well. And I think that's something you do really well. Like, I wouldn't think that you're, no offense, but I think when you think of some stereotypes around plastic surgeons, sometimes they can be rather arrogant, or sometimes they come off a certain way, and I just don't think I've ever captured any of those vibes from you. Like Jessie said, certainly never heard a negative word about you. So really, really glad you're here.
Keep it up, no pressure.
Thank you.
I want to hear a little bit, let's credential you, Dr. Kim. What are your specialties that you'd love to share with the world?
Well, I'm a double board certified facial plastic surgeon. I specialize in rhinoplasty and aging face surgery, so facelifts, brow lifts, upper eyelids, lower eyelids, lip lifts.
Can't wait.
Jealous.
And really just concentrate on the neck up.
Amazing.
Nice.
Okay. And how long have you been doing this?
So I have been in the field for it's around 15 years now.
You're not that old.
I am. I got a big one coming up.
Oh, really?
Oh,
Is
yeah.
it 40?
It's 30. Yeah. And I started off in academic practice. So my first job out of fellowship was at Mayo Clinic in Arizona for a couple years. It was a little hot there. I am from the Northwest, so I came back up to Portland. I was at the university here for a little too long. So for 8 years, and then we've just celebrated our 5th anniversary in private practice.
Congratulations.
Congratulations.
Yeah.
And that is located in Northwest Portland off of
25th and Lovejoy.
in Lovejoy.
Yeah.
Beautiful building with a mural on the side, ample parking, great air conditioning, right?
Great air conditioning, boxed water.
Love it. So you're from the Northwest. Are you from Portland specifically?
I'm from the Seattle, Bellevue area.
Okay.
So I was born in Pennsylvania,
Huh.
but moved well before I could remember.
Okay.
And we ended up in the Seattle area from age 2 to when I took off for college. So 2 to 18. Went to college on the East Coast and then came back for med school in Seattle.
Why Portland?
So the last step of my training fellowship was at the university, so OHSU.
Right.
And I was in Arizona. I was kind of looking to come back to the Northwest. Just that's where my wife's from. That's where I'm from. Really like the region in general. And then I got a call and was recruited back to the university. And I felt like, I just had such a great time during my fellowship. Really fell in love with Portland and just wanted to come back.
That's awesome. Yeah.
So when you came back to Portland, there's a number of questions I have about your entire career, and I'm just going to start with some random ones here.
Wait, I have a question.
Okay.
Is this your first podcast?
This is my first podcast.
We got him!
Well,
and
guess
I've been
what?
asked a few times before.
Really? Oh my gosh.
But you're the first.
Oh my gosh, I have a follow-up question once we get through all of these.
We're taking you to Sassy's after this.
Sassers.
Guess what? You're our first too. Our first guest.
Our very first
guest.
Caviar.
You'll always remember your first.
I know. We have a lot of fun memories with you.
I was going to say, let's talk about when we first met you. I think that's a great segue. So we heard through the grapevine that you were starting a practice in Portland. We heard that through mutual friends in the industry, and they're like, oh, so-and-so is moving in. You should try to work with him. He's great. He's a nice guy. Very nice things about you from our mutual friends. And so we were kind of talking about you a lot. We're like, I wonder, we had been at our current establishments for a while, and I think it's normal to wonder, like, maybe what's next.
And you were opening up down the street, and this was 2018.
I think so.
2018, and...
Or 17.
It was...
When we met.
19.
Okay.
19.
Wait.
Yeah, I think you're right. Yeah.
in the
Yes.
spring.
Yeah,
Yes,
time.
June, like around June,
Yeah.
like maybe a little bit before then.
Yeah.
It was when Jeuveau came out, guys.
Yes.
So whenever that
Evelyn
was.
had just
Yes.
launched. So, anyways, so we're literally like in line talking about you. We had seen you on Instagram.
No, we were set the scene. We're at the
okay.
Vegas Cosmetic.
No, okay. We had just gotten to Las Vegas. We were in line to check into our room in this god awful line at the Bellagio, I think. Right? And I'm like, I think this duck's the real deal. No, we were at the Bellagio.
Okay.
We weren't staying at the Aria.
No.
Dr.
Bellagio was
somebody
where
else
the
was.
Yeah.
hotel was. Yeah.
So we're just like, oh God, this sucks. And I was like, yeah, but maybe we can meet this cool doc this weekend. See what he's doing in Portland, yada yada. And then you walk by, and I'm like, there he is. That's him. And then I think we see your wife walk by. We're like, oh, I think that's his wife. So anyways, we're kind of like spying on you for like a day or so, and like totally saw that you were there. And then I don't know how the rest transpired, but Evelyn was having a big party at the Cosmo.
Yeah, at the Cosmo.
I think you're right.
Yeah.
At the Cosmo. And I happened to be on the big screen over and over and over with confetti falling all over me and just being like, yeah. And I was like mortified. But then I just like kept drinking champagne. I was like, yeah. By the end of the night, or like not even the end of the night, but like an hour in, I'm like, that's me to everybody walking through the club. Like I totally embraced it at that point. And then we had run into you and your lovely, lovely wife.
No.
Sam.
We shut down the dance floor with Sam.
Yes.
We shut it down. I had so much fun dancing with Sam.
Yes.
And we just had the best time.
We did.
Like, they don't throw parties like that anymore.
Oh,
but
yeah.
that was so fun. Like, it was such a nice introduction to both of you guys. And
It
I was just
was.
like, this is not how you'd ever think, like, a plastic surgeon and their wife would be. Like,
Yeah.
it was so fun. And you guys are just so genuine and just, like, real people. And really fucking fun.
Yeah. I remember us going back to our hotel that night being like, wow, we met some really nice, cool people. Like, those are lifers. We're going to be, in with them. We're going to run into them again. So,
I know. Then it got creepy because when we got back to Portland, I would text you guys. I'm like, when are we going to go karaoke? Like every week.
I forgot about that. The fact that we still haven't gone to Voice Box.
We're doing
I
it
know.
tonight. We're doing it tonight. No, it wasn't creepy. It was just
Not
like one of
creepy at
those things
all.
that, well, one, I fucking hate karaoke.
She gets secondhand embarrassment. Give me a mic and I
like-
will never shut up.
I'm like,
She can't
God,
handle
please.
it. And for the
And
record,
now she's podcasting.
every time we go to Los Angeles, we end up at this disgusting place called the Gaslight, and she hears me sing the same 3 songs
Yeah.
every time. So she doesn't hate it that much.
It's different. I don't know. That place has charm.
But no, not creepy at all. I'm bummed we didn't do that. We
I
still
know.
need to.
Yeah.
Do you like to sing karaoke?
I'm not good at it.
Okay.
I'm not a good singer. I have a terrible voice.
Okay.
But I'm a performer.
Yeah. You are. See, the problem with me is I think I sound amazing until I hear it the next day and I'm like, why didn't someone pull me off the stage?
I'm like,
Like,
go on, sweetie, you got this.
Did I really have to sing Dixie Chicks Landslide again?
Yes.
Like, someone pull me off the stage. Sheryl Crow? Come on. I always pick some random guy out of the audience and I'm like, let's sing Picture by Kid Rock and Sheryl Crow. And I just like hope and pray they do a decent job when I get them up there.
It's so funny, girl.
I'll sing that one with you.
Okay.
Oh, I can't wait for this.
That's what I was hinting at. Practice, okay?
Can Sam come meet us?
Yeah. So, I obviously want to pick your brain about so many things. Jessie and I both do. But one thing that I really want to know, especially as you shared your journey kind of becoming a plastic surgeon, was there ever a time where you second guessed being in this world, this toxically beautiful world that we are all involved in?
I don't think I've had like an existential crisis where I'm like, oh, this was the wrong like field to go into. I love doing what I do. There are definitely days though where you're like,
Yeah.
tomorrow's another day.
Yeah,
You
hit the
know?
reset button.
Exactly. And I think you guys have all had some of those interactions either with, there's some, I think we're going to talk about a little bit of some of the
Yeah.
Yeah.
patient interactions. and things
Potentially
like that.
problematic patients.
Yes.
PPP.
What do you do to kind of separate yourself from that when you get home? Because, you've got
great
a lovely family, and I know it's really hard for me to not take it home.
You're a dad of 2 and a husband, so like how does that play in?
Yeah, I think I do a pretty good job of compartmentalizing it. Like I'm not like. We have a dog now. I'm a dog dad.
Congratulations.
But I don't do the proverbial like I'm so mad I'm like gotta kick the dog or something like that.
Yeah,
that would be abuse. That'd be bad.
Sure.
I'd report you.
But in fact, like the dog is the only being in the family that is always consistently happy to see me. So
Unconditional.
makes things better every time.
It's so amazing.
But sure. I mean, I think that as long as I know that I'm treating people, I feel fairly and well, and being a good doctor and a good human, I can rest easy that I'm in my own skin, like that. I'm doing right by people. Sometimes they don't feel that way. It's rare, of course.
Sure.
But yeah, so I don't really like bring that home necessarily.
Was there ever a time in your journey where you contemplated a different field in terms of medicine?
Early on, really early on, I always knew that I wanted to be a surgeon, just because I liked working with my hands, and I just thought like there's this divide when you go through medical school, and they say it's medicine versus surgery, and medicine is more of like internal medicine and the associated fields, and so I'm going to take a lot of flack for this, but like the medicine side of things, there's a lot of the people on that side, they do a lot of mental masturbation.
Okay. Yeah. No, thank you. I'm picking up what you're putting down. Okay.
So, but they're the deep thinkers.
Right. Okay.
And then the surgical side, the procedural side of things are like the doers.
Right.
And so what's nice about doing surgery is that, you do an intervention and then you have a result, and it's relatively immediate. So you have that like immediate gratification part of it. Whereas like if you're in medicine, there can be some frustrations where you're treating patients and ask them to take their medications and they don't, or they don't make lifestyle changes, and a lot of those benefits are reaped way down the line and are not like from an intervention that you've done like directly. And so I wanted to be a surgeon. And then because I liked sports, I wanted to do sports medicine. I thought that was what I was going to do, like sports medicine, like orthopedic surgery. I had one of my first observations with a orthopedic surgeon who was doing like a hip replacement, and it was brutal. I mean, it's like taking a big knife all the way down to the joint, like deboning a chicken. Sorry.
No, it's okay.
Really
Bring it.
Yeah, it's okay.
Just bleeding all over the place.
Really?
And so I just felt like it was a lot more, barbaric could be the word, versus what I ended up going into. My training was ear, nose, throat, and head, neck surgery, where it's all neck up, and the anatomy is a lot more interesting, like the special sentences, and it's just a lot more intricate. The journey then went to wanting to do like head and neck cancer surgery, and it's a great field. It is pretty depressing.
Yeah,
I can imagine.
Outcomes are not great, but I also started gravitating towards the reconstructive, the soft tissue, the plastic surgery aspect of it, and that led me into like the facial plastic and reconstructive surgery realm. So I did that for a little while, like both cosmetic and reconstructive, and then just from like a lifestyle perspective and not having to be in for trauma and late nights, I transitioned the practice into a cosmetic surgery practice.
So when did you get married? At what point in your career did you and Sam get married?
We got married in my residency.
Okay.
So
she's been through this with you.
Yeah,
very
but
much
we've
so.
actually, so we got married about 7 years after we started dating.
Oh, wow.
Yeah, I was a first year medical student at Washington, and she was a junior, third year undergrad there.
I didn't know that about her.
Yeah, so she's seen it from the beginning and had to make the big move to Baltimore. It was at Hopkins.
Oh my gosh.
It's hard to take
She
someone
did
out of
that,
Seattle to
yeah.
go to Baltimore, but she did it.
That's pretty amazing. I love that part of your story.
First like week she gets there, snows 3 feet.
Oh no.
Yeah.
Which
So, yeah.
people think from the Northwest that we're like so, we're accustomed to cold and stuff, but
Yeah.
we don't
Yeah.
know what we're doing the second it snows. So.
For
We're
sure.
accustomed to misery.
Okay.
3
Speak for
inches of snow.
yourself, California girl. So, another question I have, did you ever have any type of an artistic background? Like, were you an artist growing up? Did you have interests that surrounded arts?
You know, that's a great question. I wasn't. I felt like I had some artistic bent, and I enjoyed it. I can't tell you that I'm like an amazing sculptor or painter or anything like that. I actually think my daughter, she really has a lot of talent in that
Oh,
realm.
cool.
She should come talk to Vince.
Yeah. Bring her.
But it is one of those things, and you hear a lot of. I think it's a little bit over. It's people talk about it a lot, like surgeons, like, oh, I'm an artiste.
Yeah.
You know, like
Mm-hmm.
I sculpt on the side or I paint on the side, and that informs me to be like a better surgeon. And I don't necessarily know if that's true. I mean, I guess having like the ability to understand 3 dimensions and have an understanding of beauty.
Mm-hmm.
You know, and of course, that's a loaded term,
Mm-hmm.
different for everybody.
Mm-hmm.
But yeah, I don't
Do you feel as
take
if
myself as like
maybe your skills are more technical?
yeah, and there's form and function, right?
Mhm.
So
Right.
there's like the technical aspect. There is some artistic aspect. I mean, so for instance, if I didn't do what I'm doing now, like if I were in some parallel universe, I've always thought that I'd want to be an architect. But you know, not
It's very technical art.
Yeah.
I mean, it kind of lines up.
That's like
Checks out.
that's Vince's parallel universe.
Yeah.
thing.
and I mean, it's probably completely unrealistic to say this, but you know, I wouldn't want to be like the person just making like apartment buildings, you know,
Right.
like an office
Mhm.
building. Like
Mhm.
I like the Frank Gehry or like
Yeah.
the Zaha Hadid.
Something
Like it's like the
beautiful.
beautiful, like the form is amazing, the function is cool too. So someone called it Starchitects, you know, the celebrity architects.
So I think that you are an artist
Oh, thank you.
because I feel like when you're so focused on medicine, it's easy to say like, oh, I didn't have a background in it, and therefore I wasn't like thinking about that when I opened a practice or brought that into your field. But I feel like your practice, your before and afters, like everything you do it's just very high quality, good, really good taste. Like, so I think you have more artistic
Oh,
bones in you than you're willing to admit.
I appreciate that.
Yeah. I mean, I do think not all plastic surgeons are created equal, and I know we'll get into this more, but your outcomes are absolutely so natural, so stunning, and that's for facial. I feel like facial is the hardest, the most challenging, because it's just 1 millimeter, half a millimeter makes the world of difference.
Hard to cover up too, right?
Yeah.
Much harder to
There's-
cover up. It's not
yeah.
something you can cover with clothes or,
Yeah.
you get a bad boob job. You can
Yeah.
kind of still go about your life, but you get a bad nose job. I mean, I've been there. It's not the easiest thing to navigate.
It's not
So,
forgiving.
with that being said, what is your favorite, if you had to choose, I know it's like picking a child, but your absolute favorite procedure to perform?
That's a great question. Yeah, it is like picking a child because there's really like 2 worlds. Like when if I were to split my practice into 2, there's like the rhinoplasty side of things and then the aging face part of things. And the reason why I find it like an exciting time for me is that like they're so different, and you have to have so many, and the patients are so different. You know,
I
obviously
bet.
like most, there's exceptions too, but most of my rhinoplasty patients, they probably fit within that window of like 18 to 30. And then you have some older, 40, 50, 60 even, some a little younger, like teens too. And then like the aging face patients are 50 to 70, usually around there, and then there's some things in between. So it's just, it kind of depends on the day. Like, it's whatever surgery I'm doing that day is my favorite. But I mean, I'll tell you, there's a couple things, like with rhinoplasty, I've just been doing it a lot longer. And I think that's a really natural progression for facial plastic surgeons, because a lot of them start off doing like insurance cases and just doing like some little changes here and there. And so I think it's probably your first foray into the cosmetics world, like right off the bat.
Is that because you're usually catering to like functional issues?
Correct, yeah.
Okay.
And so then there's like the hybrid, and you know, there's the functional and the aesthetic, and then there's the just aesthetic.
Gotcha.
So most people now, they don't come to me for just functional nose surgery. They'll come to me for aesthetic or aesthetic plus functional.
Right.
So, and I think that, like, for me, at least in this region, I feel like I'm in a really good spot there. It's almost like I don't have to think too much about the surgery. I don't do this with any surgery anymore, but like, I don't have to stay up at night being like, oh my gosh, I'm so nervous.
That's very
that comes with experience, right?
Totally.
Like, that's, you know,
I'll see a patient on my schedule and be like, I'm not going to do her tear troughs. That's so intimidating.
Exactly. And then so the aging face part of it, you know, I think that I think I'm a really good surgeon in that respect as well, but there's still so much out there to learn too, to just continue to refine techniques. And there's some amazing surgeons out there, and several of which I've visited. And, you know, like I said, I have a big birthday coming up. But I think that it keeps it fresh because I'm still learning. I'm going to England this September and seeing a surgeon out there. And so,
that's really cool.
Yeah.
Love that.
What time in September? We're going to be in Paris.
Right after
Italy.
Labor Day.
We're going to be in Italy from the like mid-September to October, but we're going to Lake Como.
Oh,
should we break down the
wedding?
Yeah.
Yes.
Yes, we are.
Should we break down the dance floor in Lake Como? Maybe.
Is George going to be there?
Oh, that
Clooney.
George? He's in trouble right now. He's in trouble for his political actions lately. Let's not go there. Yeah. So, do you have an outcome? Obviously, can't talk too much about specifics, but do you have an outcome that was your most memorable with a patient that sticks out to you, where you're just like, wow, I changed that person's life?
And you know, I didn't come prepared for thinking of one, but just one that comes to mind. And it is one of those things where it's tricky to like operate on people who are severely distressed about their appearance to the point of like wanting to harm themselves.
Yeah. It's a very real thing.
It is a real thing. And I had a teen who she was just completely distraught, and apparently she had some types of attempts. I'm sorry to talk about this. And her parents were just the sweetest parents. And, you know, of course, as a parent, you're going to want to do anything you can for your child to make them happy and or not to be in that state. And it was really apparent to me that, like, it was not the time to do, like, surgery on the patient until they like, turned it around, got some help.
Yeah, some mental health help.
Exactly. And so that was, you know, my message to the parents and the girl. And so I worked with their therapist, and we'd like talk on the side on like, you know, this is where we need to be, and I need to basically see that she has made a lot of progress in her mental health, because what happens if you have a bad outcome, or what happens if you have an outcome that they don't like even after? Like it's a lot of pressure on the one surgery to turn things around. So, you know, we have to be in a really good spot. And then I saw her probably 6 months later. It could have been a little bit longer. Her attitude had totally changed. Like, she was on the right medication. She was getting the right help that she needed. Her parents were supportive. And at that point, you know, even though I had some hesitation, you know, we're I felt comfortable doing the surgery.
You had the right team.
Yeah.
And good on you for doing that.
Yeah, for collaborating with her therapist.
Yeah, and she
That's a
got
lot
a
of work.
really nice result, and she's super happy, and like,
Yeah.
so I think in that way, like, sometimes like a well done nose surgery can really change a life.
Totally.
For like, you know, you have someone who's in their teens and
Yeah.
for a long time.
Well, thank you for sharing
Totally.
it. That's amazing.
Yeah.
So next question, because you just set it right up for me. How do you approach body dysmorphic disorder, better known in our field as BDD, and when someone just has like raging, unrealistic expectations?
The short answer is you don't operate on them.
Yeah.
The long answer is we actually went to a new type of consultation process. Part of it was so we could get patients in, like, who are really serious about surgery.
That's smart.
So we do a lot of like pre-consultation screening. We do it for free. So that part, like the photo assessments are free, followed by you know, an offering of a consultation or not. So to get into little nuances of that, basically what they do is they send in photos, they do a pre-health questionnaire. There are BDD questions on there. There's health questions. So, and then we ask them to outline their goals. So they'll do a little paragraph of like what they're looking for. Sometimes, like, it takes you 2 seconds to realize after reading that this patient would be very difficult to please, because they may be seeing things that you don't see, or they have very specific issues that are like not visible to anybody except them. And so, you know, it's an initial red flag right there. Sometimes it's just glaring bright red, and we don't offer a consultation.
What verbiage do you use?
Yeah, how do you shut that down? How do you deny?
So our patient care coordinators are great when they do that. You know, I let them do the dirty work.
It's
Just kidding.
easy. I'm sure they have a copy cut.
Something I'm very used to doing for all of you, so I can relate.
Well, it's nice they're not physically in the office.
Yeah, that's
Yes.
very
That's an
smart.
awkward thing. You know.
For sure. And so I think also because, like, I don't want to waste their time to come in for me to tell them I'm not going to operate on them, you know. I mean, and sometimes that still happens. They'll get through certain stages, but at least there's like a filter for a patient who has the right motivations and has an issue at hand that we can help. So the verbiage goes something like, are you Seinfeld fans?
Oh, yeah.
Okay.
When you said your parallel universe was an architect, I immediately thought of George Costanza.
There you go, yeah. So basically there was an episode where his breakup line was, "It's not you, it's me." So, I mean, it's part of that. But,
Yeah.
I mean, to be real, like, we tell them the truth. We're like, we feel that it would be very difficult to meet your expectations.
Perfect.
Because it doesn't necessarily say that, like, we're bad at surgery. It's just that the match is not good.
Right.
You know, like, we can do the best surgery in the world, and it may just not, like, mesh with their idea of what is really good. I had a virtual consultation once with a patient who, and I almost laughed because, like, I didn't know she was serious until she was serious. But she actually said that she would like her nose to look like Michael Jackson's nose.
Oh, no.
And I told her, I don't think that we're a match. I just don't think that we can, you know,
Did
that
she
doesn't
look
really
at
align.
your website?
Yeah.
Did she look at your portfolio?
I wonder if she found someone to do it for her, too.
I don't know. That's the thing. Like, I have told people, and maybe I don't have the opportunity to tell them anymore because they don't get in the door, but I have had people, when I'm denying them for surgery, when they're in front of me, I'm telling them, it's like, I love doing surgery. I think it's what I do. But you really should listen to someone when they tell you that you don't need surgery.
Yeah.
Like, if a surgeon's telling you that.
Yeah.
Yeah.
But if you go around you are going to find someone's
going to do this.
Who's going to operate on you.
100%. It's just like
Because the
lip
motivations
filler.
are there.
Yeah, absolutely.
That's really, really
Yeah.
kind, good advice.
Yeah.
If you think about Michael Jackson and all of his nose jobs, like coming back to MJ, you know, I'm sure that he went into several consultations and someone, you know, he said, I want this and this and this. And the doctor said, I'm not really sure I can do that. How about $1 million?
Yeah.
Oh, I'm sure, maybe I can help you. You know, like,
Yeah.
so there's going to be someone who, you know, maybe the motivation is not outright like a dollar amount or something, but there will be someone out there who will operate on you, and, you know, both patient and doctor will probably regret it.
Yeah.
Speaking of celebrity faces, if you could get your hands on one celebrity's face, who would it be and why?
This is easy.
Okay.
Oh, wait. Can I guess?
Does it start with a B?
Yeah.
Yes.
I knew
Bella.
it! You would fix
I've
her
mentioned it a
nose.
couple times. It's like,
Bella
call
Hadid, come
me.
to Portland. You can stay with me.
I know, like, you know, I mean, who
What is that?
would think Portland?
What is that called? Isn't there? Is
So
there
she has a
name?
really, so she's got a couple, like she's got some issues with her tip too, but she's got a classic, what's called inverted V deformity. So what that is it's a real, like a discrepancy between the width of the bony portion of the nose and then where the nose becomes cartilage in the middle.
Okay.
And so, like, if you
Right
feel
here.
with your fingers here, like, where your glasses rest, but then march it down. See, like, where it gets hard and then soft, it's like this. And so it's an inverted V, or lambda, I guess. Chevron.
Yeah.
Okay.
And so it collapses there, and it's wide here. So it requires, like, some grafting techniques, and usually, like, rib grafts and things like
So
that.
what's your favorite place to graft from? The rib?
It is the rib, yeah.
Okay.
Yeah, for multiple different reasons, but basically it's plentiful.
Yeah.
And
It stays put, right?
well, it's stiffer, and you can get straighter pieces. Like, if you use the ear, it's curved and it's
Oh,
soft.
interesting.
Yeah.
And then the nose, like inside the nose, usually it's been accessed already, so there's not usually enough in there.
Right.
So those are really the two areas, and so the rib is typically, unless it's like something really small,
Where in the rib do you take it from?
it's more towards the front. Like, it's the rib is part bone
And cartilage?
and then cartilage.
Oh, yeah.
And so it's basically like, if we're talking about like nipple line and sternum line, it's about like a third of the way, like around the crease right there. It gets covered up by bras or, you know, whatever.
In our
Swimsuits.
Nobody Knows episode, I think episode 9, I had shared that, you know, I had cartilage taken from the back of my ear. And my ear hurt way longer than my nose did.
Oh, yeah.
It's still to this day, I'm like, is that a phantom pain? But yeah, I mean, I think that the ENT who had done the surgery had made a comment about, should have went for the rib, because there was a little bit of movement and it wasn't as structurally sound. So.
Do people like not really go for the ears as much anymore because of that?
I think the ear works in certain spots. Like, if you're looking for contour, like, or just like a little bit of volume, but structurally speaking, it doesn't have a lot of like heft to it.
Interesting.
It won't like
That makes
keep your
sense.
nostril open, like should you need.
Yeah, I mean, I just think that rib is so much better because you can get curved pieces, straight pieces, you know.
Fascinating.
I mean, people worry about the risk of it's really low risk from if you go to someone who does a lot of it. From a pneumothorax perspective, like introducing air between the chest wall and the
Yeah,
lung.
that would freak me out.
Sounds scary.
Yeah.
I love it.
We do it in the office all the time. You can come
Really?
watch it.
Okay, I will. Say less. Okay, I want to know how young is too young to get a facelift?
It's a great question. 18? No.
That's fair.
The age thing comes up a lot, but it is truly individual on how fast people age. I mean, I'm looking at people sometimes who are like 52 years old, like 3 years older than me, and they have big, like, turkey gobbler and lots of anatomy jowling, etc. And then you have some people who are in their 60s who don't have any of that stuff, you know, without surgery. So I think genetics plays a huge part in it.
Do you think lifestyle plays a larger part or like an equal part to genetics?
Please don't answer that. I don't want to know.
I do.
Let me live.
I do. So far, I feel like I'm doing great and I do whatever I want. So
It's all going to come crashing down.
and then I'll go to him.
It's hard to say, like, exactly. I would say genetics is probably the number one thing. But no doubt you see people who smoked a lot or had just tons of sun. I mean, the consistency of the skin can be challenging to work with, you know, when they've been baking in the sun for 60 years, right? But I do think genetics has a lot to do with it. You know, bone structure is a big thing. Like patients who have like a very weak chin, that can be more challenging, and they can also have earlier aging changes. There's just like less support. So there are certainly different types of patients' anatomy. I mean, different types of patients whose anatomy will inform me on how to like set expectations.
Right.
You know, there's certainly like some like with really beautiful bone structure, just a little sag. I'm like, this is going to be snatched.
That's nice.
The other ones, you're like, you have to set some expectations a little bit differently because, first of all, they've never had a really snatched neck.
Right.
But there are some techniques now that we can do to actually change that whole thing, you know, to kind of combat some of the natural anatomical shortcomings there. But, yeah, I do think that, like, there's not really a set age. Probably the average age is around 50 to 60 is, like, kind of where we see most of the patients. You know? I do think that the age ranges have shifted towards younger. There's a little bit more of a push towards earlier intervention. Back in the day, I think it was like, I'm just going to let it all go and get one facelift.
Totally.
Yeah.
Now
After
it's,
50.
yeah, exactly.
Yeah.
Like, or like even later, you know, 70 or something. But now doing like earlier interventions, but, you know, clear-eyed in that you know that you're probably going to need or want something else done down the road. So,
is there a limit to how many like you can have in a lifetime? Are you cut off after a certain point?
Like how many heart surgeries can you have? How many valves can they put in there?
Someone told me, so I had an upper bleph about a year ago, and you know, my doctor said, yeah, you're an okay candidate for it. You're probably going to want another one. And then someone had told me, I forget who it was, that you can only have like 2 blephs in your life. Is that true?
no, I don't think so. I mean, honestly, it's
like
just
bummer.
It's all based on anatomy.
Yeah.
You know, there's certain types of like blephs that you can do. Yours looks great, by the way.
Thank you. It was minimal.
Yeah, I mean, and you're young, but like I've done blephs on probably the youngest person I've done, and you guys know her. She's really public about it. I won't say her name. She's one of our great reps. I did her bleph at age 29.
I know she is. She looks great.
Yeah, and so she.
This isn't the only thing you did for her, right?
Yeah.
Yeah, I know who she is.
Yeah.
She looks
Oh,
amazing.
yeah. She's 29?
Yeah.
She
Not
looks
anymore.
incredible. Okay.
She's younger than us.
Yeah,
We'll give her that.
Yeah.
She looks incredible.
Yeah.
She looks
Yeah,
incredible.
she does.
She's great.
And okay, I'm going to say this because so many people told me not to get a bleph, that you didn't need it, you should wait longer. And like I understood all that. I understood that I would need another one, but I was so happy I did it. And it's like, it was so subtle. It was just a few millimeters, and it was something I really wanted for probably like 10 years. It kind of had like a genetic heaviness. And I do think that, you know, there's an element where we've kind of talked about this before, but if you know you want to do something, just like stop listening to people.
Just do it.
Yeah. Within reason.
There's so many
Within
opinions
reason.
out there.
Yeah. Like it's
I
just,
felt like you kind of tried to talk me into getting one though.
okay, well, who doesn't want?
But that's the thing. That's what's a little fucked up is I had never looked at myself and been like, huh. It just was never something I looked at until you brought it up.
And then now every day.
Now I'm like, wait, I'm a little heavy up there.
I don't think I tried to convince you that you needed one. I think I tried to convince you that I needed one. I was sending you old photos of me.
You had said something to me that was a little triggering. You're like, I have beautiful eyes and I wanted them to show. And I've always had hooded eyes.
You took that personally? Come on.
Whatever. I'm not ready. Okay. But I might think about it. All right, I'll call you.
Yeah. Is she ready?
I don't want to know. She also told me to ask you if I needed a lower facelift, and I was like, "Can I just get a lip lift for fuck's sake? I just want to start with a lip lift."
Baby steps.
I've messed with my face a lot. Okay, that actually brings me to my next question because it's something that everybody is talking about with semaglutide or GLP-1s. Are you seeing a surplus in people that need facelifts after weight loss?
I don't know, how much I've seen that's directly related. Mm-hmm. I think semaglutide, people, it's transformative. For some people, it's amazing. Mm-hmm. And definitely there is some excess skin. When someone comes in and they say that they're going to lose or they need to lose 30, 40 pounds, I will tell them, if you are planning on losing 15 to 20 pounds, you should lose it first.
Yeah.
Before getting your neck lifted.
Mm-hmm.
Now, I literally can remember one person who lost that weight before. I actually just saw her today for some protest.
Weird.
But in that way, if they, obviously, everyone should work out and eat right and all that stuff, but it is hard to lose the weight, and all the data out there is so strong now. It might be something that everyone's on, blood pressure meds. And
I sure hope so. I lost 30 pounds from Monjaro, and it didn't go quick like everyone else. It took months, which I'm actually kind of grateful for because, I had already had lipo at that point. I already had a BBL, and so I think it helped my skin stay kind of tight. It didn't drip off. I wished it would have at the time, but it did take quite some time.
Do you think that's something you'd ever integrate into your practice, in a holistic way?
I feel like we're a pure play sort of practice.
And you don't do body stuff, so
yeah,
don't
that's
do
true.
body
That's
stuff.
true. That's
Yeah.
true. Because I feel like so many people are doing that now.
Yeah.
And I've never really thought of myself as opening a big med spa or anything like that.
Stay niche.
Yeah.
Stay niche.
Yeah.
Classy.
Yeah.
I mean, I always feel if they want a doctor to do it, and again, I tell everyone this, I'm really open about it, there are certainly a subset of people who are I just want to see a doctor to do my injections, and I'm
oh yeah, that's something I'm always debunking. No offense, doc.
The nurses and nurse practitioners, PAs, if you do something a lot, you're going to get really good at it, and you inject 10 times the amount that I do. I mean,
I don't know how much you
pretty
inject.
sure. I'm pretty sure you're a lot better than I am.
Botox is never going to be your bread and butter, right?
No.
And that's a waste of time for you.
Right.
Why would you be doing 20 units of Botox when you could you have a skill set that is much more valuable? You save your hands for the good.
Please do. Leave that BD syringe alone.
Yeah.
Okay.
Exactly. I mean, I enjoy doing straight Botox more than I do fillers and stuff. Just because it's easy.
I think it's boring. I guess if I were having an off day, I'd rather have a Botox day. But I like doing fillers or just stuff.
Right. It's kind of like your operation. That's your specialty in your art, and
yeah, that's fun.
Yeah, that's pretty cool.
I have another question. Okay, if you're someone who is consistent with your neuromodulators, and they're going to be consistent post surgery, when do you get it prior to a facelift?
I don't really care, honestly.
Really?
Yeah.
Interesting.
I mean, especially neuromodulators. I don't think there's any real
But what
issue
if
with
it's
that.
an upper breath? Would it change how you?
I guess it depends on how strong of a brow lift they get from the chemical brow lift. But
Chemical brow lift. Never heard it phrased in that way.
Oh, yeah,
Love
I've heard
that.
Surgeon right here.
Surgeon.
Wow. Chemical brow lift.
Yeah.
Great.
Maybe,
I might steal that.
maybe that's overselling it.
I love that.
Yeah.
Just got one.
Yeah. I mean, asking people to stop their Botox is like,
Yeah, that's true.
ask them not to eat.
Got a piggyback question on that. So, I am so lucky to get a lip lift with Dr. Michael Kim next week, and
Jealous.
What?
I have been getting lip filler for, I don't know, however many, 16 years. You are not making me dissolve any of my lip filler. Is that
Yeah.
something you do like pretty standard, or like why or why not?
I used to. I'm not militant about it, but I used to say, like, yeah, we need to dissolve all your lip filler.
Right.
But now I've kind of become more measured in that approach, that if you have a good amount of, like, migration,
Right.
then certainly I think at least the migrated portion of it above the vermilion, we should definitely do that. But for the rest of it, I think it's fine to have it in there.
So you're saying Jesse's done a good job?
Hey, that's not all me.
No, it's definitely not. There's been like 12 people
Takes
in
a
this
village.
space.
Yeah. But I love that approach because a lot of people are saying, like, I won't even do your lips until you dissolve all your
Everything,
old lip
right.
filler. Like, that's
mean,
a big
why?
thing. I know. And
Yeah.
I feel like it's fear-mongering. Like, I
Yeah.
feel like that has been a really big fear-mongering part of aesthetics in the past couple of years.
Yeah, we talked a lot about that in the Gateway to Aesthetics episode, just about how there's a lot of shame in like lip filler and it like migrating and it being like the patient's fault and all
Yeah.
these different types of things.
Yeah.
So
But I love how you approach that. If it's above the vermilion, like, it's not doing anyone any favors. Like, you'd want that dissolved even if you weren't
Yeah.
having a lip
Yeah.
lift.
yeah.
What about, like, filler in that piriform? Does that get in your way at all for that?
No. I'm not seeing that to be an
Good,
issue
I got
there.
a lot there too. You're gonna have fun in there, man.
Because that's what I was worried
He's gonna cut my little thing out, you know.
Can
Well,
I
the-
keep it? Put it under my pillow.
Put it in a locket.
Put in a dehydrator or something.
Please.
Sick. Eat it like a placenta.
My
Get
sister.
my magic powers. Okay, we're getting weird.
Sorry.
Next question. Ooh, have you ever found super old
PDO threads.
while you've put someone's face back?
I found a few threads in a facelift.
Did it make you gag?
That didn't make me gag. I think honestly, I think the worst was finding threads in the nose.
Oh.
Like, I don't understand like the reason behind putting it in the nose. It's not helping anybody. Like, it's, you know, if you think that like injecting the nose is dangerous, like, why are you sticking this massive bore needle into the nose?
18 gauge.
Yeah,
It's
it's silly.
yeah.
You know,
It looks so traumatic, but people are doing quite a bit of it. You know, they go,
Sick.
and that has to leave a scar, like right on the tip of your.
yeah, I don't know. I mean, this probably will get me in trouble a little bit,
Come
but
on.
you know,
We like getting canceled
Yeah.
here.
yeah.
That's the
I mean,
whole point.
threads, they have their place. They do have a very short-lived result.
Right.
I think the problem with threads that I see also is that, like, when people show their results, it's like an immediate result.
So like
It's
that
never-
immediate like tack back look.
Yeah, and so I don't ever see anything like a longer term follow up. Like, even if it was just a month, maybe like, hey, you know, like, that's after all the swelling's down, after the initial pull's down, you know, and things have settled, then we're seeing something. But I never really see that.
That's why we don't do it.
Yeah.
Yeah.
And then, you know, I know they're not the same type of threads, but there's some like social media posts out there where there's like literally 100 threads under the neck, and I'm like, that's not lifting anything.
Yeah.
You know, that's not doing much. And so I don't know. Maybe I'm open-minded to things maybe working a little bit, but I'm also skeptical, and I'm skeptical about everything anyway.
Yeah.
So
It's a good way to be.
Yeah. we're never early adopters actually in our practice.
It's a really good way to be. I feel
Yeah,
like
you don't want to be the first person to try
Exactly.
something out.
We've learned that, in some cases, a more challenging way. You want to wait, let the dust settle after its FDA launch. See what.
Let's not even talk about Quo, okay?
No.
Don't say his name.
Horrible. We're like, we're never doing this again.
I'm still scarred from
We're
that.
never going to be the first
like,
person to
physically,
launch
literally.
an aesthetic treatment ever again.
Okay, so this is something that is really across the board. Everyone's talking about in aesthetics. Dr. Chestnut released that video of like physically cutting through Sculptra during a facelift. Did you see that?
I think I saw that. Yeah.
Yeah, and everyone was just like, I'm never doing Sculptra again. So what's your take on Sculptra maybe 10 years prior to a facelift, or maybe like 1 year prior to a facelift, or all of the above?
Yeah, I mean, I know I have a lot of colleagues out there who are like, no Sculptra. Surgeons, injectors, anybody in the aesthetic industry, we're a very dogmatic bunch, right? So when they believe something, it's like it's applicable to all situations, which I don't believe in that in general.
I love you.
The other thing, like, and I do Sculptra every now and then, and I've had a lot of experience with it because as a fellow, I used to do it in like the HIV lipoatrophy patients, which was like its initial indication, and it works. I mean, you need to do a lot of it in certain patients, but it definitely works. Now, from a scarring perspective, certainly like, your scar is collagen, right? So that's basically what is happening, is that there's a reaction and it's creating collagen, and sometimes you will get nodules and stickiness underneath the flap. But I'm one of those that believes that there's really no virgin faces anymore, and you just got to work around it. There's lots of devices out there, non-surgical lifting devices that people are doing, and I've even done too on patients that go in that plane where you're going to operate. But to tell someone who's like age 30, like, don't do anything and wait until you're 55, I think it's unrealistic.
Probably more than ever.
More than ever.
Yeah.
And then also, like, of course, and the reason why I say there's no virgin faces anymore is because everyone wants to try something before surgery, both from a cost perspective, recovery perspective, and also just kind of the, maybe the stigma of getting a facelift. So instead of like saying like no one should do it, I don't think that they're like dangerous treatments. There are some out there maybe, like, if they're applied inappropriately. We just got to work around it.
Have you ever had a patient straight up lie to you and then you find out when you have their face open about like maybe having an implant or something under there that you weren't expecting?
There definitely have been some cases like that, but I don't know if they lied. Like, I don't know. Like, it's interesting because a lot of patients forget. And you would say, like, well, how could you forget that? But I have patients who, like, had some, like, major, breast reconstruction, or they had, like, a facelift, like, less than 10 years ago. They don't remember the surgeon's name.
Yeah.
Yeah.
They don't really know what,
It's
they're just
nuts.
like, do what you got to do, take my money.
Yeah. Poor
Yeah,
historians.
but a lot of them just don't remember. And so that's interesting. Some people remember every detail, but it's just how different everyone is,
Right.
So when someone tells me that they've never had filler in their cheeks, and then when I'm under the flap, I have, literally HA on my scissors.
Nuts. That's crazy.
Oh, I would love to see
Yeah,
that.
I mean,
Wow.
it's just like glistening, and it's just like,
Wow.
old on top of the
And
scissors.
it's like, is it glistening when it's that old?
Yeah.
Oh, that is
Yeah.
fascinating.
That's
Yeah.
so cool.
I mean, we've had situations, I know, where I've, had to handle patient issues where they're like, I injected an implant. They didn't tell me they had a cheek implant.
yeah. Oh, yeah.
And I put a syringe of Voluma and an implant or something like that. So that's why I asked that question, because we'll have people be like, nope, never done anything. And it's like, wait a minute, we just punctured your implant.
Yeah. Or I've had people say, like, I've never had a nasal surgery before. I'm like,
That's a weird
when
big
I went
one.
under there.
Yeah,
That's a big one
you
to
don't
lie
forget
about.
that.
Yeah.
Yeah.
It's in the middle of your face.
You have a scar that's like this that I see.
So
Yeah.
weird.
Is there anything you see injectors do that you'd wish they'd stop?
Ooh, that's a good question.
Lay it on her. Tell
Yeah.
the truth. Tell Jessie what you want her to stop doing.
Being mean to Bre.
We'll get there.
Well, I have seen injectors inject like radius in certain areas, like the piriform that you're talking about. It's a pretty dangerous area from a blood supply perspective, you know, and so the case could be made that, yeah, HAs, you can dissolve it, but with the radius, if you get an occlusion with radius, then what are you going to do, you know?
Yeah.
So I'm not sure why anyone would do that.
So for our virgin listeners under there, that's right under the
basically
nose, right
like
on
where
bone.
the nasolabial fold and like the nostril meet.
So it's a very vascular area where there's a lot of veins, right, and different
Arteries and veins.
arteries.
And stuff, yeah.
So, like I said, our virgin listeners out there, you clog one of those and you could cut off blood supply to something else. So not good to do with something that's irreversible, like radius.
Yeah.
How'd that sound?
Yeah.
That sounds great.
Okay,
Damn,
good.
are you in the medical?
I have an art degree. Thank you very much.
Yeah, I've actually seen someone who was dealing with a radius occlusion from another clinic, and it was pretty brutal. But she did okay. She didn't have any necrosis.
Thank God.
I want to know your take on influencers in the industry and them trying to, get some gratis from you.
Some free surgery.
Yeah, I mean, you get approached every now and then. I mean, I try to shut them down sometimes in a funny way, like if they'd comment like, bro, DM me, bro. I'm like, yeah.
Do you run your own social media?
I do.
And it's all you.
It's all me.
Hell yeah.
Yeah.
That's why it's so good. You're an artist.
Thank you. Well, like, as an aside, the reason why I run my own social media is, number one, I'm probably too cheap to, like, hire someone to do it. But at the same time, like, I do think people like that it's me because it's a genuine, it really is me. And
It is.
all the dad jokes are there. They're all mine. Because you can definitely tell when a social media account is not the voice of the person.
You can totally tell.
Yeah.
You can tell when it goes to a social media manager, and then you can really tell when it goes to an agency.
Yeah.
You just can.
Yeah.
You're like, who wrote this caption?
Yeah.
Nobody that actually works physically in the space.
Yeah.
Totally.
I mean, you get a lot of offers for like, people have asking for free surgery, and I was like, I mean, that's okay. I don't need that.
Yeah.
And I'm gonna post it to all my followers, et cetera, et cetera. I mean, just kind of the way social media works is like, there's people who just want to have like as many followers as possible, and some of the influencers who have a huge platform, they're like, I'm gonna get my followers to follow you. But unless they're like local or regional, or if you're at the top of the game and everyone's going to travel to see you, you don't need those followers anyways.
Totally. Yeah.
So it doesn't necessarily like help you anyways.
Totally. It's the same as an injector.
For sure.
Or like, yeah.
There was a unnamed influencer, hundreds of thousands of followers, like in the area here, who I remember, this is a few years back, posted one local med spa saying like, this is my favorite place to get Botox. They do the best. This is my only injector. Like, maybe a month later, a different med spa, same thing.
I know who this was.
And then
On ours.
I don't know if on yours actually.
It might have been ours.
And then like just a month ago, recently, I saw that same woman, and it was a third practice in the area. I'm like, she's making the rounds, So
But how did her face look?
pretty good.
That's good.
Really good.
Well, hey.
So I've never played that game, like, and you certainly see people who do, like surgeons who will buy followers, buy engagement. Again, I don't think it helps you. Like if, there's some people in town who would have like 100,000 followers, and they'll put a post up, and it might be a nice result. They'll get like 15 likes, and like you could butt dial. If you had 100,000 people, legitimate people following you, enough butt dials would get you to like 1,000 likes or something like that.
Yeah,
you know?
totally.
So.
Yeah, it's funny. I like, you think about what the end goal is with that. Like, what are we actually trying to do here?
Yeah, are you asking your phone to ring? Like, what exactly is going on?
Yeah.
And you made a really good point. Like, if they're not local, especially when it comes to Botox, like, am I really going to fly to Miami to get my Botox because I follow this person on Instagram? Maybe for like a BBL, but again, a lot of people actually, you know, I have access to, I could have gone anywhere to get my surgeries, but I wanted to be home.
Yeah, and you couldn't have flown for
No, so I think a lot of
Get a fly on that pillow.
Yeah,
horrible
and brutal
drive. Anyways.
Yeah, I do think about like what people's goals are with social media, and like, do you just want to look like you're a bigger deal than you are by having however many followers? But it's always so clear.
Yeah.
The relationship of the amount of likes, the amount of people who are commenting on your stuff, compared to the amount of followers. It's like anyone, I'm not even good at social media, and I can see that and know that. So,
but then what does that say about the integrity of the person doing that?
I mean,
you know, that's that to me is like, yeah. It's just, it almost takes you down a notch. It's a little embarrassing.
Agreed.
Now, that being said, I'm almost at 12,000 followers.
And you earned every one of those.
I earned every one of those.
Yeah.
You sure did.
But when I look at like my followers by region, and I didn't court these followers, but there's like 4% from like Pakistan or something.
Oh, interesting.
Right? Like, if you break it down. So, I mean, I think like if anyone ever wants to work with an influencer, they should ask to look at their like demographic follower thing.
Yeah.
Because
that's a very good point.
If they have a bunch of fake followers, it's going to be shown there.
Yeah, that's so interesting.
And that's a wrap. Just kidding. We've got much more for you, babes. Join us next week for the part 2 of our interview with Dr. Kim, where we answer some more thought-provoking questions and, of course, wrap with a toxic story. See you next Thursday, and until then, stay toxic.